September is National Suicide Prevention Awareness Month, and my guest this morning here on Jersey Magazine is the Chief Medical Officer at Rutgers Health University Behavioral Health Care, Dr. Keith Stowell. Good morning and welcome.
Hi, good morning, Jim. Thanks for having me.
We've been talking throughout this month of September, Dr. Stoll, how suicide is the 12th leading cause of death here in the United States, which is a very staggering number. But when you break that down and get into various age groups, what do the numbers change? How does it look like?
Yeah, so to your point, I mean, even just that number alone, right? The 12th leading cause of death is quite significant. Um, so uh, what we see though is in certain populations, it's an even greater number, right? So in younger adults, adolescents, we're seeing increasing numbers of suicides, as well as in our older adult population. But even over the course of the last several years, we've seen sort of changes on where that lands. But when we look at the overall numbers, we're talking about 50,000 or so deaths by suicide in the US per year.
You mentioned that over the past few years, you've seen some changes. How much would that be related to COVID, do you think?
That's what, some of that data is still playing out, right? But we are seeing that there's been an increase in depression, anxiety, suicidality over the course of the pandemic years. Some of that's related to difficulty accessing services in the way people were in the past. Some of it's been due to increase in isolation, loneliness, bereavement, and death, in fact, from COVID. So to your point, I think some of that increase that we've seen or some of that change is attributable to the pandemic.
One of the things that we hear a lot about is the effect of social media, especially on younger kids. Bullying has been around forever. It is not new. Parents, I think, do have maybe a bigger obstacle with social media these days. But how much do you think social media does play into what happens with young kids and the increase in suicide rates with them?
It's a great question, and it harkens to some of the recent hearings that have been going on in Congress and other forums related to trying to protect kids from social media. I think it's multifactorial, but I think you're right. Bullying is a big aspect to it. And one of the challenges with social media, whereas, as you said, bullying's been around for almost time immemorial. It used to be within a small population, right, within school, and it wasn't necessarily blasted to a much larger group. And for our adolescents or our children who can really struggle dealing with that and not really have good coping strategies, that sort of online bullying can play a big role in worsening depression, anxiety. Sometimes we unfortunately even see it encouraging kids to commit suicide. That is, some folks may bully other kids into saying, hey, you should commit suicide or other sorts of things like that.
But and again, I know that when I was a kid, you'd hear somebody say that to somebody else. So that hasn't changed. But you mentioned the scope because now you're hearing it all over, not just in that group of kids, that you may be dealing with in school. I have three children. My oldest knows what the world was like before social media took off. My two younger ones do not. And I can tell you as a parent, it was a daunting task in all three cases to kind of monitor what they're seeing. Who are you talking to? The same thing you do with regular friends at school. What did you do today? Who are you talking to? What were you talking to them about? That sort of thing.
Right. And it's a great point. I think the challenge with social media is it can be very hard to monitor, what you're describing, right? Kids have their phones, their iPads in their hands at all times. So no matter how diligent parents are, it can be very difficult to monitor social media consumption on an ongoing basis.
So, what are some of the things that listeners can do to help someone who might be considering taking their own life?
So I think when we talk broadly, not even necessarily just talking about the adolescent and child population that we were just discussing, I think there's really a few approaches folks can take. I think some of that's monitoring for signs of worsening functioning or worsening depression, perhaps. maybe someone who's more isolative, tearful, crying, not eating, not behaving in the way that they normally behave. It may be an expression of suicidal thoughts or thoughts that I'd be better off dead. It may be folks taking preparations, perhaps, as they're thinking about suicide. So, someone may complete a will, they may start giving away some of their important belongings. And of course, not saying uh, putting together a will is necessarily a bad thing, right? Of course, something like that's important, but when you put it together in the totality of the presentation, so if someone's talking about being more depressed, you hear them saying, hey, it would be better maybe if I wasn't around anymore. Then they start completing a will, that maybe is a different picture. So I think monitoring for those signs is important. Talking with them about it, hey, are you okay? Is there any kind of help we can get you? It's okay to talk about suicide and ask them, even straight out, have you had suicidal thoughts? Some folks are concerned that sometimes asking people about it may encourage them to think about it more. But the reality is, one, it doesn't do that. It actually may give folks some relief that maybe they'll get some help, they'll have someone to talk to. And two, the reality of if someone is thinking about it to begin with, just talking about it with them isn't necessarily going to encourage that any further. Uh, and then, depending on the resources that you have available, it might be something that you feel comfortable talking about them with. It might be something connecting them with their primary care doctor, a therapist, bringing them to the local ER. And then I think another important resource that's really just come about over the last several months is the National 988 line. Whereas before we've always had access to 911, 988 is a national line that's available for mental health emergencies. So folks can call for themselves, for a loved one, they can text, and then have access to appropriate resources, whether talking with someone on the phone, perhaps talking with a crisis worker, or sending out a crisis team to the home to talk with them. So I think those are some of the steps that folks can take.
One of the things that I noticed when I went to rwjbh.org and looked up some of the information that you have online was when someone comes to you, whether it's a family member, a loved one, a friend, they say, don't promise confidentiality. And I was kind of struck by that because I think if someone does come to you in confidence, that's a very, very fine line for the person who's listening to that. Like, what do I do? This person just told me all of this. You do want to provide some kind of confidentiality because I think you want that person to continue to feel comfortable speaking with you about something so serious as this. And yet at the same time, you want to take it seriously and make sure that they get the help they need.
Yeah, it's a great question, Jim, and I think something that both as individuals and then as physicians or other providers of mental health services that we have to deal with, and that being that there are some exceptions to confidentiality. So, as a provider, for example, if I'm seeing a 14-year-old, I may not share everything that they're telling me with their parents, but if there's some sort of immediate safety concern, that is maybe suicidality, I generally will have to breach that confidentiality and share it with their parents because that overrides sort of that confidentiality piece. So, same to your point, though, if you're talking with a friend, a family member, um, you're right. You don't want to necessarily break their trust by saying, "Oh, absolutely, there's nothing that you're going to tell me that I'm going to tell anyone else." Typically, I'll encourage them, please share what's going on and let's see what we can do to get you some help. And if that means, maybe going together to get that help. But if there's an emergent situation and you do need to reach out to 911 or some other provider, bring someone to an emergency room, that's generally going to outweigh the confidentiality, even in the context of that kind of personal relationship.
Dr. Stowell, for WDHA and WMTR listeners who want to learn more, maybe they're dealing with someone who has expressed these thoughts to them, or maybe perhaps they're having suicidal thoughts themselves. Where can they go?
So there are resources available with the National Alliance for the Mentally Ill or National Alliance for Mental Illness, NAMI. So that's for friends and family dealing with an individual who might be struggling with suicidal thoughts or really any sort of mental health condition. There's also the American Foundation for Suicide Prevention, which has access to a variety of resources. And then, as we talked about, for emergent situations, calling 988 or bringing folks to the local emergency room can be an important place to go as well.
And I mentioned your website as well that I had referred to earlier, rwjbh.org/behavioral health. Dr. Keith Stowell, thank you so much for your time this morning here on Jersey Magazine.
Absolutely. Thanks for having me, Jim.